It's Health. This Tuesday morning, Dr. Femi Aderiye is here, the CEO of Pearl Dental Clinic, Lagos. Now, he's a dedicated clinician with a passion for the highest standards in clinical dentistry. And today, we're doing aesthetic dentistry.
Well, we'll try to.
We'll try to cover it as much as we can, yeah?
Yeah.
So, we know a number of people don't just go to the dentist just because they have a problem with their tooth. They want to make it, they want to make it look better.
Yes.
It's okay, and I know that's where braces and a number of things come in. What is the market like for aesthetic dentistry? Do people really just go and work on their tooth just because of aesthetics?
Well, there's quite a growing demand for aesthetic dentistry right now. A lot of people want their teeth to look brighter, want their smile to be brighter, especially, you know, on individuals like yourself, people who are very much in the media. So yes, there's a growing demand, and it's not just you know, media personality and influencers and such, but even general regular people who are not happy with their teeth.
Now, what are the risks involved with aesthetic dentistry or aesthetic surgeries and all that, if there are? Well,
yes, there are risks because patient selection really matters. And when I say patient selection, I mean the treatment is not one size fits all. So what might be good for this person might not be good for that person. So take, for instance, someone who has very weak teeth, all right? And when I say very weak teeth, I mean the enamel is very weak and all that, and the person wants to get veneers done.
What is a veneer, by the way?
A veneer is basically like a layer of ceramic that's wrapped on the surface of the tooth, just to cover it, yes.
Okay.
So it's made out of ceramic, so to speak. Let's just, in a nutshell, ceramic.
Same ceramic we use on our plates?
Yeah, similar.
Same kind of material or
porcelain,
okay.
Zirconium, Emax, basically ceramic, just like the plates. So that it's glued onto the tooth. Now, if the tooth is weak, you know, it probably might not be able to support that. Okay. And eventually, over time, it fails. So those are some of the risks concerned.
And when people go for this kind of things, like you mentioned that there's no one size fits all. Yeah, I've seen people who maybe have maybe their dentition is not so much aligned. Maybe they have teeth that come up in different places.
Yes.
Does aesthetic surgery also mean putting false tooth?
Well, yes.
Or I don't know if false tooth is the right term to use.
You know, the word aesthetic basically is about, you know, having a pleasing appearance. So if you're not happy with the way your teeth are, either by color or form or alignment, then you want to do something about it.
But can I add? So some people might know.
So if you have missing teeth,
yes, teeth,
you can replace those teeth.
Of
course, yes. That's what dental implants are for.
Wow.
So you can replace it with dental implants. And if your teeth are not aligned properly, you know, you spoke about braces just now. Yes, orthodontics. You can wear braces, but some people don't like braces.
Yeah.
So there is an alternative now,
which
are called aligners, clear aligners, which are transparent acrylic trays, which are pre-programmed to align your teeth gradually over a series of weeks. Yes.
I know that people wear braces for as much as a year plus.
No. At least 18 months. 18 months?
Yes. For braces?
Yeah.
So this procedure just spoke about, is it
more or less the same, but it's much more aesthetically pleasing in that you don't have wires across your teeth, you don't have brackets on your teeth, you're not limited in what you can eat. You can take it out, eat your food, and then, you know, put it back on. But the thing is, you know, you have to wear it for at least 20 to 22 hours every day. Every day.
Yes. You see, now that's something. A lot of people see people with braces and they feel like, oh, you have one defect. Like it's a serious defect.
Well.
And sometimes even people that wear braces, the way they even react, people have that impression that it's a defect. But let's clear that up about braces.
Right.
Defect or not?
Braces the reason why malocclusion occurs varies from habits to your own DNA. And when I say DNA, I mean the size of teeth you have versus the size of your jaw. So it's what's called a tooth-jaw discrepancy. So if your teeth are too big for your jaw, they'll be crowding. If it's too small for your jaws, there'll be spacing. So it's one or the other. Or your teeth are ideal, meaning that there's enough space for all the teeth.
Okay.
But unfortunately, I find these days that I believe man is still evolving. I keep saying that. And a lot of people end up not growing their wisdom tooth out fully because, well, I don't know. That's what happens. So I get a lot of...
Is it natural causes or is this something...
No, it's just man's development. Yeah,
it just happens.
So
okay.
I can't say this is why it is. This is why your jaw is like that, or there are predisposing factors quite all right. But to nail it down to one thing, no.
That's quite okay.
But yeah, malocclusion treatable, spacing treatable, unerupted teeth, missing teeth, very treatable as well.
Now, when you mentioned something about overcrowding. When it's overcrowded.
Not overcrowding, just crowding.
Okay, just crowding.
Okay,
when
crowding.
in that kind of scenario, what can be done? Are you going to take off some teeth? How?
Well, it depends on how much
scenario?
space is necessary, is needed for those teeth to be aligned. So, not in all cases do you need to extract teeth to create space.
Okay.
And then there are new brackets now, kind of braces that actually you don't need any extractions for it. So, as man evolves, the technology evolves as well. So, you have two options. Either you take teeth out to speed up the process, or you expand the jaw.
Expanding your jaw.
Expand the jaw to...
That is actually even more possible. That's possible.
Yes, it is possible. Bone remodels. So it's just a matter of putting the right pressures, the right torque on certain areas of your jaw, and you know, it remodels.
I remember when the first time I was passing, there was this clinic I saw, I was much younger, and I saw dental maxillofacial clinic, and I was wondering that word, maxillofacial, and all that. So it made me go and check, and that's why. So this falls under maxillofacial.
Actually,
right?
no, this is nothing near maxillofacial.
This is not
is
more complex.
Yes, it's more intense. It's basically full-on surgery, theater, anesthesia surgery.
So if I was going to do my jaw, that's not full on. That's not even. I can't say that's
orthodontics. That's non-invasive. You know, there's no, unless you know they ask a maxillofacial surgeon to come in and expose a tooth that is buried somewhere in your jaw so that they can drag it down.
Okay.
Maxillofacial surgery is another specialty in dentistry that you need a lot of training.
Training for. All right, thank you, doctor. It was great talking to you. Is there any other thing you might want to add? Maybe people things that they need to know if they want to go into all of this.
Well, you know, see your dentist.
Exactly,
every
I like
6 months.
that. When you get the diagnosis.
Yes, it's very important that you actually get proper diagnosis from the qualified personnel, and you know, don't self-medicate, don't self-treat.
Don't self-medicate, don't self-treat.
Yes.
Now, that's a final word. I hope you're able to pick that one. That's what we'll end up on. Thank you so much, Doctor.
Thank you.
It was great talking to you today.
As always.
All right, hope you're able to pick one or two things there. We'll just take this time up now. There's quite more to come. Stay with us.